One.
Good morning and welcome to what is going to be a great session here at the Southern Harm Reduction Conference on the importance of engaging people with lived experience in viral hepatitis advocacy. We have a wonderful panel today of patient advocates from the National Viral Hepatitis Roundtable, or NVHR. And each of our four panelists will give a brief introduction about themselves and their work, and we will go into a moderated question and answer session after that. My name is Michael Ninberg. I am also a former patient. I had hepatitis C for many years. I got hepatitis C from injecting drugs a long time ago. I lived with hepatitis C for about 20 years and was cured in a clinical trial about 10 years ago. I run a nonprofit organization in Seattle, the Hepatitis Education Project, which also oversees management of the National Viral Hepatitis Roundtable, or NVHR. So without further ado, I would like to introduce our first panelist, Tara Stamos-Bisig, and Tara is going to give a little intro about herself and the work that she does.
Hi, good morning. My name is Tara Stamos-Bisig again, and I am from San Diego, California. I go by the pronouns she, her, and hers. I am the founding director of the Harm Reduction Coalition of San Diego, and we are getting ready to start our own syringe exchange called On Point. I sit on the statewide working group for End the Epidemics for HIV, hepatitis C, and STDs, as well as the California Syringe Exchange Program. I'm on the steering committee for that. I am a former person who injected drugs. I contracted hepatitis C sometime in the early 90s. I struggled with accessing treatment because there was a sobriety requirement at the time that was at least 6 months. And oftentimes when I would go to seek treatment, or at least to seek treatment for the symptoms that I had, I was met with a lot of stigma and judgment just at the front office staff, and then working with the nurses and providers that just really didn't know a lot about how to engage with people who use drugs, inject drugs, sex workers, and the like. So I stayed away from healthcare and providers, and I tucked it down and kept it a secret for many, many years. I didn't share it with partners or even my healthcare providers. I currently work in the capacity with the County of San Diego. We work with a number of stakeholders and started the Eliminate Hepatitis C initiative at the end of 2018. We have healthcare providers across the county who have worked together along with local officials, and Ryan Clary, who is a former executive director of National Viral Hepatitis Roundtable. We worked together to come up with an elimination plan that would include people who live with and or have lived with hepatitis C, so a number of consumers. I'm the chairperson for that consumer, and we have finally got it passed in front of the Board of Supervisors in March. And so now it is the End Hep C Task Force. It was my job to go out into the community and talk to people about the barriers that they had in accessing treatment, in knowing about hepatitis C. We found out a lot of people had hepatitis C confused with hepatitis A and or B, and ways to, a number of misinformation is still out there. And so we worked with individuals in the Veterans Administration, local homeless organizations and individuals, drug using communities, substance use treatment, pediatric care. We work with hospitals, the probation department, and a number of different facilities and organizations came together under the guise of the American Liver Foundation. We had them help us, and we developed a report and a strategy and brought it in front of the Board of Supervisors. And so that is one of the things that I'm passionate about, is taking that lived experience, that time that felt like it didn't have a purpose, then turning it into a purpose today, and really using that purpose to drive my desire to be the change and to be the voice at the table for those who may not know how to use their voice, and to use my privilege that I have today to advocate for change and lower barrier hepatitis C treatment and care so that we can work towards eliminating a curable disease. Thank you very much for having me here today. I look forward to sitting on a panel with other greats.
Oh, wonderful. Thanks so much, Tara. And San Diego is lucky to have you.
Thank you.
Before we move on to Yvette, I did want to mention that we are having a moderated Q&A here for the first 50 minutes or so, after which there will be an opportunity for any of you who are tuning in for the Harm Reduction Conference to ask our panelists questions as well. So just wanted to make sure that you all stuck around for the live Q&A session. And now we'll move to Yvette C., who joins us from Buffalo, New York.
Hi, my name is Yvette, and I'm from Buffalo, New York, and I started as a client at this agency, and then I became a worker. So I went and got tested at around 2013 because I was scared, and I didn't want to, and I'm HIV positive at the same time, and I'm undetectable. So when I went to my doctor, they told me I'm like, Hep C. We dying anyways, because back then that's what they used to tell you in the streets, you're gonna die, right? So I was an IV user. I used for many years. So I decided to start the treatment because somebody who used to works where I went to get checked, told me it was a simple treatment. So I started the treatment in 2015. I finished the treatment, and I became cured, and I decided to stay clean. So I'm in that journey. And what happens is I started where I was a client, now I work with. So I go to the agency, I work with the harm reduction, and I take care of people just like me who don't know, excuse me, what to say and how to say it. So, and I'm a voice, like Tara said, that, we could get you cured here, and I go to the community, I give out needles, and I go pick up people, I bring them in to get tested. We got the funding now, so we got all these goodies with the agency, with the Hep C team. I go out with the health department in Buffalo, and that's how I do, help the community.
Oh, that's wonderful. Thank you, Yvette. And yes, you are a very passionate and powerful voice, and we're going to hear more of that voice here in a few minutes. Next up is Chris Abert, who has done harm reduction work all over the country, and is a recent transplant to Arizona. Chris, why don't you tell us a little bit about yourself?
I want to say hello to everyone, first of all. I came from Indiana before I moved to Arizona, and we have traditionally been invited to this conference as an honorary Southern state because of the political environment and the culture of Indiana. I've sometimes heard it referred to as the middle finger of the South, stuck up right in the middle of the rest of the country. So it's good to be here. I'm glad to be around people doing such great work. And I guess, I'm excited to be here because I'm just some dude who used to shoot dope and who used to have hepatitis C and who used to be incarcerated and who used to be homeless. And I never thought that those would be strengths. My mom never thought those would be strengths. And now they're on my CV, and I'm really excited about that. And I want other people to realize that, what can be crippling and debilitating in some areas of my life, at least, has become critical and essential to the work that I'm doing today. So I started the Indiana Recovery Alliance. You know, we just got on some bikes and went out and started giving out syringes because it was the right thing to do, and hot coffee and blankets. And then I met Dan Big, and he was a huge influence on my life, and took me under his wing and mentored me and taught me about harm reduction and the importance of making sure that the people who are impacted the most have say in the policies and programs. So that's what the IRA has been doing, is making sure that we're hiring people who use drugs, people who are living with HIV, Hep C, people who've been incarcerated and homeless. And when I moved to Arizona, I wanted to start a similar organization, and that's what we're doing here too. So the Southwest Recovery Alliance, it's like little franchises of recovery alliances across the country. And all of them are run by people with lived experience, including Tennessee Recovery Alliance and some others. So yeah, when I moved here, I didn't have any funding. It's illegal. Everything we're doing here is illegal. So we just started going out and doing the same thing, just going out, giving out syringes, doing some Hep C testing, doing outreach, just showing up and giving people dignity and respect, and a smile, and creating not only spaces where people can mitigate negative health outcomes, but spaces where people can receive love, and places where people can get involved and feel connected in a world where that's often denied, and at every opportunity is denied. So we started doing that. We had a meeting with ADHS, which is Arizona Department of Health Services, about a year ago. And in that last year, we've moved forward pretty much, and I'll talk more during the presentation about some of the work we've done, but we are working to get some of the pre-authorizations removed from the Medicaid authority, which is called ACCESS here. And ACCESS is actually an acronym for Arizona Cost Containment. So you know what their priority is, not health necessarily, it is cost containment. So it's been an uphill battle, but we've managed to put together a group of providers and patients and other stakeholders and have our voice heard. And again, this was just a year ago, and now we're co-convening the Arizona Hepatitis C Elimination Advisory Group for the whole state with the American Liver Foundation and the Arizona Department of Health Services. So that's pretty cool. Just some dude that used to shoot dope that had Hep C, now co-convening and leading the way through the organization, right? And having other people with that lived experience supporting and moving with us. So yeah, I think that's good for me as far as an intro. I just also wanted to say that in general, I'm rebellious and unruly by nature. So this kind of work is really great for just my personality type. And to be given a healthy opportunity, ways to fight back against depression, and join community of people like we have here, and I'm sure like you're listening to the webinar today. So I'm glad to be among like-minded folks.
Oh, that's wonderful. Thank you, Chris. And you heard it from Chris's mouth. Recovery Alliance coming to a state near you if you don't have one already.
Only if you center the voices of people who are impacted. Absolutely,
there are a few preconditions. Thank you, Chris. And I also really appreciated your mentioning, the work that we do. We bring respect and humanity to people that just don't get it enough, if at all, and that's a big part of what we do. So thanks for mentioning that. And then our fourth panelist, batting cleanup, heavy hitter, Robin Lord Smith. Robin, do you want to tell us a little bit about yourself and what you're doing in Virginia now?
Sure. What I'm doing, yeah, Virginia's starting to get fired up too. My name's Robin Lord Smith. I am in beautiful Floyd County in Southwest Virginia. I actually moved here just at the beginning of the year in February. Before that, I was in Maryland for most of the last 20 years. I was first diagnosed with hepatitis non-A, non-B around 1974. Interestingly enough, it was about 2 or 3 months after I had finished up a year in an intensive drug treatment program, a residential program, because of my injection drug use, because of my heroin use. And at that time, I was diagnosed hepatitis non-A, non-B. They didn't even know about hepatitis C then, as it turns out. Years later, most of us that were diagnosed non-A, non-B actually had hepatitis C. So, you know, I was just told, yeah, don't drink, you'll be okay. And really no follow-up for years. I was properly diagnosed with hepatitis C in 2001. I had been working as a counselor at a drug treatment program for a while, and a couple of the people that I was working with were diagnosed with hepatitis C and were on treatment. So I got tested and found out, yes, I in fact did have hepatitis C, and probably had it at least since '74 when I was 19. So I probably had it for at least 30 some years, although, you know, I could have gotten it as a child. I'm a baby boomer. I also had a transfusion when I was 12, and whenever a doc asks me how I got hep C, I take that as an opportunity to tell them why that's really not the first question, or maybe even a question at all they need to be posing to their patients, but that's another story. So I was diagnosed with hep C, and I was very scared. I was very not engaged in Western medicine at that point, and started hearing about the treatment at that time, the pegylated interferon and ribavirin. And I went on the early internet. I mean, we're talking, you know, around 2001, and found an amazing group of people. I found hepatitis C support group. They were actually in Delphi forums back then, and there were a couple of bulletin boards. And I really believe that I would probably be dead today had I not found those people that had been living with hepatitis C and were getting treated. And some of us were getting cured then. The treatment was a lot more challenging, a much lower success rate, and there really weren't that many of us, relatively speaking, that were even diagnosed. But when I was diagnosed, I actually was still working as a counselor at a drug treatment program when I started treatment, and I had to stop working about 5 months in. But I did get cured, and I also started being involved in patient education, support, and advocacy with those online efforts. We did some organizing outside the group. We did some marches in DC for hepatitis awareness. We just started doing a lot of work. I ended up working for Hepatitis C Association, who I've been working with now all these years. I'm the vice president. One of the big things that we do is Help for Hep, which is a peer counseling helpline. All the people that answer the phone there are people that have been cured of Hep C. And we provide health information, emotional support, and referrals. All of our counselors, quite a few years ago, I made sure that they were all educated in harm reduction, and they have all, can honestly say they're harm reductionists now. Was not a long shot for them to understand why that was such an important part of what we're doing. I started doing, with Hepatitis C Association, I started doing a lot of hepatitis C education at drug treatment programs and continue to do that today. I also started a coalition in Maryland, the Maryland Hepatitis Coalition, Karina Dan from Health and Human Services. And I worked with our state health department, with our coordinator, and formed a coalition and started going out and identifying stakeholders, including people with lived experiences. That coalition, I'm happy to say I left Maryland and I left that coalition in good hands. And just this morning, had the first meeting of the Southwest Virginia Hepatitis Coalition, a little core group that includes providers, people with lived experiences, harm reduction organization in Virginia, and we're really excited about getting more people with lived experiences involved in that. And I also was very involved in the planning and production of the MVHR Patient Summit we had last year, and the ongoing patient advocate group that we have that is working at elevating the people with lived experiences voices and getting us involved in making sure that we're at every table that where anyone is talking about helping people impacted by hepatitis C and all viral hepatitis, quite frankly.
Great. Well, thank you, Robin, for that great intro to your work, and congratulations on getting the Virginia hepatitis work group up and running. That's no small feat. I want to put in a quick plug for the MVHR patient advocate group that Robin is heading up, and we'll get some contact info here for you before the session is over, so you can be sure to get in touch with Robin if you're interested in doing more with MVHR and hepatitis advocacy in your state, and also with our federal advocacy as well. So we're gonna jump into the Q&A here, and I think this question is one that each of you have touched on, but can certainly give a little more detail on. Why is it important for people with lived experience, whether we're talking about having had hepatitis C or being a current hepatitis B patient, or someone who used drugs, someone with a history of incarceration? Why is it important for that lived experience to be part of the advocacy efforts that we all do? And we can start with Tara again.
Hi, I think it's really important to center the work that we do in advocacy around people with lived experience. If you look at the parallel HIV movement, it is not until people with lived experience really joined that movement and brought their personal experience, their personal struggles, their triumphs and their challenges to the table, and really became a voice for HIV, and that's when that movement really got some momentum going. Not that other people didn't have the best intentions, it's just they weren't coming from a place of lived experience. And so just like in any harm reduction area, whether that's working with sex workers, people who inject, people who use drugs, you can bring all the education to the table, but there's something missing in that component of what it is like to live that experience. And so as a person with lived experience, coming to the table and with my experiences and how living with hepatitis C impacted childbirth, impacted accessing care and treatment, how it, excuse me, how it has impacted how I show up at the doctor's office and all of those things, I'm able to best, well, in my opinion, but I am able to work with those people who are providers in a different sense, whether it's a medical provider or an insurance carrier or any of those folks, people at the local, state, government levels, and bring that lived experience and sit at the table and be that expert on how to best work with individuals who have lived experience, to talk firsthand about the barriers of living homeless, living incarcerated, living, a day-to-day existence that's really riddled with stigma and lack of dignity and respect, and really showing up as that face that says, look, here I am, and it's not a scary thing, and I'm the face of hepatitis C, or I'm the face of injection drug use, or I'm the face of sex work, I'm the face of recovery, or I'm the face of a social work student, like what all those things, how they intersect, and really bringing that to the table, I think is extremely important in this movement.
Oh, thank you, Tara. I think, everything you said really resonated with me, but when you said we are the experts, that is the case, right? No one knows what it's like to be a patient better than a patient. No one knows what it's like to use drugs than someone who uses drugs, or be incarcerated So we are the experts, and I think that is really, the strongest argument for centering our voice as people with lived experience. Yvette, what would you say about the importance of people with lived experience being part of and really the center of advocacy efforts?
I think to me, right, it's very important because it gets us, we know how we lived, and bringing it to somebody's table and telling them, look, this is how I lived, right? They're gonna look at you like, really? Did you live on their bridge? Did you, and they understand. When I go to see the legislators in Albany, that's mainly what we tell them. We don't tell them anything else, but the stories was happening in our communities, people living under bridges, people that are, with the Medicaid, with the MAT, this approval stuff, that they go to the pharmacy, they can't get their prescription, right? So you walk them through that and you become one of them. And what happens is they feel comfortable that they're not being judged, and you looking at them like a human being. At the end of the day, they're not a stranger or somebody how they look at them. Because that was part of my story. I used to go to places, and the minute they used to see my track marks or because I was skinny, whatever, they used to put a stamp on me, and I used to don't want to be, don't talk to me about health places, because I'm not going there, because of course, back then there was nobody who understood us, right? Where we coming until they start putting these peers in positions, or people who are having the life experience.
Oh, that's beautiful. And I think you said it without saying the word trust. And that is so critically important with the work that we do and the people that we work with, because like you said, a lot of us were distrustful of whatever the institution was, whether it was healthcare or the police, and coming to people with a shared experience, a shared lived experience as a peer, we know is the most effective way to get people what they need and what they want. So thank you for that. Chris, what are your thoughts on the lived experience role in advocacy?
I think, like, who else would do it? We have everything to lose. Our lives are literally at stake. I feel like, my experience when I was told I had Hep C, I hung up the phone and acted like I hadn't gotten the phone call, and then I lied to doctors for years because I didn't want to not be able to get insurance because of a pre-existing condition. And, I just wanted to stuff it down and not have to deal with it. And the phone call was like, you have Hep C, you're going to die, and click. Because people didn't know. We didn't know what Hep C was then. So I over a long period, I've come to know that that reaction and the denial of people to be able to access treatment is part of a larger system of drug policies and of control over certain populations. And as a white person, I am actually just a peripheral damage in that it was centered on communities of color historically, and continues to be centered on communities of color. So knowing that my denial and these like pre-authorization requirements are just one small part of this larger system that's meant to disempower people. And then I look back through the history of other movements, right? And as was mentioned before, the HIV movement with ACT UP. And I think about the civil rights movement, obviously was led by Black people. Right now in the streets, Black Lives Matter is and should remain centered in all of the pushback against our carceral system. So I just look back and I think no group that's being oppressed has ever escaped that oppression without leading the fight. And again, we have example after example. As far as when we talk about substance use disorder as well, on top of it, I even think about like peer supports. The whole idea of peer supports today seems like it's been co-opted, and really it's like an arm of the carceral system to make sure you're doing what you're supposed to be doing. And if we look back at peer support, at least around mental health, it was like people like the Network Against Psychiatric Assault, right? Or the Mental Patients Liberation Front. These folks were fighting against asylums. They won, right? We had like 500,000 people in asylums then, and now we have under 55,000 people in asylums. They were, put there for their whole life against their will, without their permission. So when I say peer support, I mean people who have experienced that oppression, who have experienced horrific treatment, who have experienced and lived that stigma, who have to constantly lie because if they don't, they'll be incarcerated or denied health access or have their kids taken away. That's what I mean. When I say peer, I mean, you and I have that shared vantage point. And if we don't have that vantage point at the table, talking about what that experience is like, I don't think we stand a chance of actually overcoming it. And the last thing I want to say is, so again, since this has traditionally been pushed at people of color and communities of color, one of the reasons we're talking about this, we're talking about the opioid crisis, all of those things, is because white, suburban, and rural people are being affected. White posterity is in jeopardy. So it's incredibly important to make sure that those traditionally marginalized communities get the resources they need, so that if the white community, addresses their opioid crisis or addresses whatever crisis it is, that those communities are abandoned again to suffer alone. So yeah, that's why I think it's important to have people who are impacted because it's part of a larger system of oppression, and no group has escaped oppression without leading the fight.
Oh, great. Thank you very much, Chris. And we certainly are at a moment now in our country's history and, in world history, frankly, looking at kind of these, historic systems of oppression and white supremacy, and it is all very tied together. And the result, of course, we've seen over years has really disproportionately impacted communities of color. And so I think there's a really strong message to be sent, and you just did, to bring in those who are impacted by whatever it is that we're addressing and have them at the center of the discussion. You also mentioned stigma, which also affects all of the work that we do. It affects people coming out and getting whatever it is that they're dealing with addressed. Hepatitis C patients, for example, hiding it for many years, something that I didn't talk about for many years as well. I was diagnosed and kind of intentionally forgot about it for about 10 years. And that's something else that we'll talk about a little bit more during the rest of the session. So thank you for bringing that up. Robin, what would you say? You're definitely in the middle of a lot of efforts around centering the patient voice and advocacy. What would you add to this robust discussion?
I think I'll keep it kind of brief. I mean, I think right here we have, with my fellow panelists, a really good example of why it's important that people with lived experiences' voices be at the table. It's something that I've tried to insist on for years, and I think, during our patient summit, it was a message that I repeated a lot, didn't I, guys? Of, not only is your voice as important as anyone else's in the room if someone is addressing anything relative to policy, access, rights, it's more important than most of them, and sometimes all of them. I think that, our rallying cry is not original and you know, with proper respect to ACT UP, but nothing about us without us. It applies across the board with all this. We know. I mean, I have endless stories of people who've made a difference because they were in that room. And had they not been there, things would not have come out the same, and progress would not have been made. People would not have been helped the way they needed to be helped. I kind of was joking before we started, but you know, all these things back here with my name on them, they're just places that I said, hi, I'm Robin, and this has impacted me, and I have input. And working with people, working with patients, survivors, counselors, people on the helpline today still that are being constantly turned away, still being disrespected, unloved, rejected, judged, stigmatized by the very people that are supposed to be helping them. It just makes me more and more determined to try to help people understand how important their voice is, and to make sure that they are pushing their way into those meeting rooms and getting on those tables and being on those calls to be sure that we're represented.
Oh, that's beautiful. I think, you know, one of the things that you kind of said almost in passing there was, you know, what we see behind you were places that you showed up, and
Exactly.
showing up is such a huge part of everything we do. And you know, being an advocate, being vocal doesn't come naturally to a lot of people, but we find over time when you show up over and over again, people find their voice. And it's certainly something that that I learned over years. You know, showing up, just showing up, not saying much, and then slowly becoming more comfortable telling my story. And but that's the first part of it, is showing up. So thank you for showing up, Robin.
Hey, I will add, a lot of people aren't comfortable, you know, and there are still times when I'm like, oh my gosh, how am I going to do this? I'm not up to this right now. And all we really have to do is think about all the people around us and all the people that we're connected with, and remember that we need to bring their voices too. We're representing not just ourselves, we're representing our whole community.
Yeah, I mean, I think that's an important point. I think it's a privilege and, you know, potentially a responsibility to give voice to those who just don't have it. And I think when we show up, good things happen. Well, thank you for that, Robin. We're going to move along here, and I wanted to ask Yvette, how have you used your story to impact your community? You touched on it a little bit, but what is it about telling your story, whether it's to the participants in your programs or legislators? How has that played out for you?
Well, what happens is they trust you, right? They trust you, and especially our people, right? They trust me, and they look at me different than a person with a diploma from an office, right? Because it's a way different, you know. It's like, and you cool with me, okay? Well, come on, I could get you, you know, linked with this clinic. I could bring you supplies, right? I could go on the bus and take them whatever they need. And they look at you different, not being judged, you know what I'm saying? Because of course, there go I was there, so I understand the pain that they're going through, and they can't sometimes get out of where they stuck at, because some of them are stuck somewhere, and it's hard. When I used to get high, it used to be hard for me to go to the needle exchange, which there was I think one, and it was like, I might miss something if I go down there, right? So I'm not going. I would use the same syringe, right? And that's how my Hep C came, right? Because I started using everybody else's cookers. And so now the community looks at me different. They look at me like, if she could do it, I could do it too, right? But at the same time, they call me and they ask me for the help, because I understand them. If I can't maneuver this way, then I go to somewhere else and maneuver, right? And because I've been there, I know if I don't call Tara, I could call Robin. If I can't Robin, I call Michael, I call Chris, right? Because we all got our living experience. So it's very important.
Oh, that's beautiful. Thank you, Yvette.
Mm-hmm.
You talked about the syringe exchange, and depending on where a person lives in this country, still, sadly, access to sterile injection equipment is really varied. A lot of the folks that we work with do advocacy around syringe exchange laws and drug paraphernalia laws. And I know some of our panelists have done that as well. Tara, what can you tell our audience about advocating for changes in harm reduction laws?
So here in San Diego, we have an extremely conservative board of supervisors and other elected officials locally. Statewide, we have some a little bit more liberal folks, but the laws that specifically govern San Diego County, where I'm at, there's been one exchange that's been in operation for about 20 years. It's a 1-for-1 exchange. It's currently capped at 30. You need to have an ID. There's a lot of barriers to accessing treatment, and it's only in it's only in this little 1-block radius of downtown or another other neighborhood. But we are, I think, like about 5,000 square miles of a county. We are huge, and we have a number of transportation issues, a number of other things. So the individuals who inject in San Diego, the estimated number is somewhere between 5 and 27,000 people who inject currently, and at this moment, about 7,000 of them are enrolled in the current program. And because of the strict policy, the county has a ban on syringe service programs. So we have had to work. We actually did a lot of the work in the syringe area under the guise of hepatitis C. So we knew that if we were going to bring the initiative in front of the Board of Supervisors surrounding supporting the elimination of hepatitis C, and written into that initiative was we couldn't even write harm reduction. We had to put services that reduce risk. We couldn't even use the term harm reduction in a lot of the stuff that we did. So it was talking to people about who may not have been okay with injection drug use prevention or harm reduction stuff, but they were okay talking about hepatitis C. So we have really worked to educate people around eliminating hepatitis C by providing safe injection supplies to people, meeting them where they're at, not leaving them there, encouraging any positive change, using a lot of the harm reduction verbiage in talking to local officials, getting to know the city council members, getting to work with people on the HIV Planning Commission, all the different local organizations, working with the LGBTQ Center here, working with doctors who provide PrEP, all of those things in an effort to even start to have the conversation around syringe services. Currently, pharmacies do not, even though they have the ability to sell syringes, there's maybe 2 or 3 in the county that are okay with it, and that depending on who's working, you can even access purchasing them there. So there is a huge gap right now. I took that initiative and worked with people at the state because I don't need county approval, I can get state approval. So my program is in the process right now of being approved by the state, so then I can kind of circumvent that whole thing and find another way in. And I have built those relationships with people having the discussion about hepatitis C, about HIV, about overdose, about all of those things, and then talking about syringe service programs. So being able to get to know elected officials, sitting at the table, commenting on public comment periods for different opportunities, emailing, all those things have, after something like 3 years, have begun to make a difference. And on the same day we had the Eliminate Hep C initiative passed, we also asked the county to lift the syringe service ban. And although it's a pending vote, we still have some movement. And it's about not being afraid, bringing good data, being polite enough, and using that privilege, you know, and centering it around people who have lived experience, and really not being afraid to continue to have that conversation, because people who are uncomfortable with that conversation will be fine with you not having it again. So I continue to have that conversation to hold people accountable and continue to bring light to the importance of having syringe service programs, especially in the effort for ending hepatitis C and or HIV.
Well, congratulations on that great work in San Diego. I mean, so many really kind of valuable points there. I liked being polite enough, because you don't want to be too polite. I also really appreciated, you know, reframing the issue, right? If people who inject drugs today is going to be a non-starter, then bring in the infectious disease folks in the PrEP clinic, and, you know, people who care about, you know, public health, you know, and then we can talk about people who use drugs, you know, tomorrow after we get it set up. So
Right.
I think that is a very strategic way to get to where you go.
Yeah, I think one of the important things I learned along the way was also do my research. So when I knew I was getting ready to go meet with an elected official or talk to somebody on a board or a commission or whatever, I would Google them. I would look at their Facebook. I would do whatever to find out, look at their official profiles to see, like, what are their sticking points? What are they passionate about? What is important to them? And then individualizing those interactions to being like, I know social justice is important to you, or I know neighborhood safety is important to you, and really getting them in a spot where it's individualized, so they also feel seen and heard, and it helps them. It's me helping them to learn how to reframe what's important to them in a way that they may not have thought about before. A lot of it's fear and lack of education about this stuff, and so taking the time to have those conversations really makes a lot of difference.
Yeah, well, thanks. And I think, like you said, you're helping them as well, because a lot of times they will not appreciate how much their constituents appreciate the work that they're considering blocking until you kind of shed the light on it. You mentioned any positive change and fear, and I want to go over to Chris here now, because Chris, you've got some great experience in Indiana. You know, talk about fear, and you were there during the big HIV outbreak in Austin, Scott County, and you know, there was no syringe access there, and of course, you know, not a surprise, because that's where the biggest outbreak of HIV among people who inject was in recent memory. So tell us, Chris, you know, what it was like kind of working in that, you know, environment, and then now you're in Arizona, similar to, you know, parts of the South and San Diego, you know, conservative, but you're doing the work. So what can you tell us about kind of that advocacy around harm reduction laws?
Well, the first thing I want to emphasize is you just do the work anyway. So I'm in no hurry to go ever to be incarcerated again, but we're just out there doing it anyway. We're out there giving out syringes. We're giving out whatever we need to give out to make sure that people are as safe as they possibly can be. That's what we were doing in Indiana. It was a small program, like I said, we're on bikes, limited supplies. But when the Scott County HIV outbreak happened, and this is, for those that don't know, a small town of about 4,000 people, and 231 people are now living with HIV as a result of not having access to sterile supplies. Then Governor Mike Pence stalled and had a lot of moral dilemmas about whether or not he wanted to believe the science, and that allowed the cases to increase. So I hope other folks don't have to wait for something like that for their legislation to go through. And, honestly, it was first approved for just 30 days, which we all know 30 days of a syringe service program isn't going to do anything. And now it has a sunset clause in it. So every year we have to go in front of the legislatures again and have that extended. And it's like up to each individual county. Indiana has 92 counties. And so you have to go through and convince the two of the three commissioners for each of those 92 counties every 2 years to approve a syringe service program. And remember, this is a stigmatized and criminalized group. So what we're really doing is taking this group that is, universally hated by the general population and putting their health and life up for a vote, a popularity vote. And it's ridiculous. We wouldn't do that with the only other group I can think that's more routinely despised than IV drug users and homeless folks are ISIS, right? Where we can just like openly and blatantly wish harm upon them. And again, it all goes back to that stigma. So it's the system is far from perfect. We just, a lot of times we'll just sit in meetings and we will smile and we'll listen to them telling us what we're supposed to do. And then we leave the meeting and we go do whatever the hell we need to do and don't give a damn about what they're saying. So obviously there are some risks involved in that. Another thing is, it's not just about getting syringe service programs started, it's about stopping them from getting shut down. And predominantly across the country, the reason syringe programs get shut down is because the syringes on the beach, right? Syringes at the playground, syringes everywhere. You're putting my kid at risk to save these people who don't care about their health. Well, A, we do care about our health, we're just denied access. And B, there's never been a single case of HIV or hepatitis C transmission from an improperly disposed syringe in the United States, ever in history. I'll wager money on that. And so what we've also been doing is going where we already have syringe services legalized and sanctioned. We're going to key powerful players and letting them know. We want to do community education about it as well to take away some of the fear that community members have. But really what we need is the people who are in charge of making that decision, for them to know that syringe litter is just that, it's litter. Right? It's about as dangerous. What I'm scared about when I'm picking up syringe litter is that it's in the corner where people have been urinating and defecating. I'm not scared of the syringe. I'm scared of the other unsanitary conditions people are forced to live into or live in. So I also agree with what was said before. We have to, in conservative states, I lead with $250 million in cost for Scott County. And is that something that you want to add on to your budget next year unexpectedly? Or the cost of continuing to, treat people, the symptoms of hepatitis C as opposed to curing hepatitis C. I don't like doing that because I feel it again pushes down all the issues of racial equity. It pushes down the right of people who use drugs to have their health care, to have their health needs met. But we have to do that. We also find strange bedfellows, and I'll end with this. When I moved to Arizona, I was surprised. A person named Dr. Singer, who's a fellow at the Cato Institute, one of our most vehement supporters, all right? So again, as was mentioned, we have to go out and find these people that are on our side. And there's we personally don't work with the police much. I know many states like North Carolina worked really closely with police. We don't do that. But what I did like, something that Robert Childs used to talk about, was the village people method of getting the legislation. And that was having doctors show up in their white coats, having police show up in their uniforms, right? Having priests show up with their frock on. And you know, there's something about that. Let's use people's kind of obeisance to authority against them. Yeah, if they're going to be authorities and tell us what we can and can't do, let's bring in some other authorities. And I love pitting authority against authority. And at the end of the day, we have the charts and the graphs that show that we're right. And we also have the tide of history that shows we're on the right side of history. So it can be demoralizing, but sometimes we win.
We do, and I do love the idea of really using the tools that have been used to subjugate us to really kind of elevate our position. Thanks, Chris. And yeah, I also love just do the work. You know, we don't need the authorizing legislation to do it, and you know, that's how we got to where we are. You know, folks sitting on street corners with card tables and, jumping in cars and delivering. And it's not without risk, like you said, but, it's a qualified risk, and we try to do it as smartly as possible. So switching gears here a little bit, we've got about 15 minutes before we open it up to Q&A. The work that you all do can be really elevated if there is buy-in from local public health, local and state legislatures. So Robin, let me ask you, what has your experience been in working with policymakers, and what advice do you have for advocates to really kind of make that that argument for whether it's removing treatment access restrictions for Medicaid patients, or easing syringe service laws? What's your experience been in the policymaker realm?
You know, Mike, I was just thinking about the years of the Maryland Hepatitis Coalition, and quite frankly, I think my biggest takeaway is what I've already talked about, being at that table and asking questions. Because, it's like with the Maryland Hepatitis Coalition. Now, I know that just bringing topics and bringing questions and challenges to the table at a meeting that also does include representatives from the different relevant branches of the health department, those questions go up. They don't stay in that meeting. And making official requests, well, what do you mean there's still a fibrosis requirement? What do you mean there's a sobriety requirement? This is not evidence-based. Educating ourselves and bringing that information to those settings and asking those pointed questions, I have seen result in responses that create action. Okay. I mean, Maryland started with our treatment access for the direct acting antivirals. We started with a requirement of a fibrosis score of 2. And there was some sobriety wording in there. Even after the sobriety requirement was removed, there was still wording there. And, it's just constantly educating yourself and challenging it. That's not exactly what you asked me. You asked me, how do you work with? But I mean, that is a way of working with those entities, is letting them know that you're a resource, that you're staying on top of the things within your realm, and you want to share that information with them because they need to know, showing up, sharing information they may not have known about, sharing opportunities they may not have known about, and knowing when the Drug Utilization Review Board is going to meet so people can come in and make statements and provide evidence. Because, a lot of people making these decisions don't even have the most up-to-date scientific evidence, and they're not making evidence-based decisions. So, we kind of have to force that science into the rooms where it's not always being acknowledged or used. Now, within the state, we got, when we started a coalition in Maryland around hepatitis, it was the Korean Dan and myself and the state coordinator, the viral hepatitis prevention coordinator. And we got a lot of support and continue to, you know, I mean, we meet at health department buildings for the most part. You know, we've told them these are things, you know, that we could use support with. You know, can you reserve a room with audiovisual? Can you support us with part of your community-based grant? You know, can we have people come at lunchtime and give them a bag lunch along with our meeting so that they can be here comfortably and stay. But also, again, you know, coming back to the question, sometimes, you know, when we're working with people in health departments, there are things they can do and things they can't do. And one of the first things we need to do is educate ourselves about what they can and can't do. And know that a lot of things they can't do or ask, we can ask. Okay. And again, you know, I may be being redundant, but coming back to that, asking pointed questions. Why is this here? This is the evidence that I can share with you as to why it shouldn't be here or it shouldn't be this way.
Oh, great, Robin. I think, yeah, so a lot there. I think one of the things that that I really heard was presenting yourself as an expert and a resource, right? You know, for a lot of the folks that we work with, less so in public health, but certainly in the kind of the legislative arena, they don't know what's happening with hepatitis C or hepatitis B or COVID or, you know, the opioid epidemic. And so letting them know that we are here to answer their questions, that we are experts in this field, I think is you know, one way to get their ear. And you also mentioned kind of the broad base you know, coalitions. So you've got this, you know, group that you started in Maryland, and you've got, you know, public health, you've got advocates, you've got industry, you've got a really good mix of folks who are trying to do the same thing. And that is definitely one of the best ways to approach the policymaker, is to have a very kind of disparate group of folks who might not seem to be obvious allies asking for the same thing. You know, you've got someone from the Cato Institute who's working with the, you know, Arizona Recovery Alliance, for example. All right, so we're going to have a quick word of advice and or encouragement for advocates who want to be involved in the space. And we wanted to talk a little bit more about elimination efforts, but I think we can address that in the Q&A when we open it up. But as we wrap up this part of the session, I'd like to ask each of you for, again, some words of encouragement, some advice, you know, a milestone that, that you remember in your advocacy work that you can share with the audience today. And Tara, would you like to kick it off, please?
Yeah, I know that one of the things I struggle with a lot is that imposter syndrome, thinking I don't belong at this table, or why are they going to listen to me? And as somebody who comes from an already enough of my own negative self-talk, and having to navigate systems through substance use and infectious disease, my own self, really what I have to say to other people is you are the expert. You're not an imposter. You come to the table with value and worth, and those things, just like Chris had mentioned before, those things that were, you know, maybe potentially weaknesses at one point, those are our strengths today. We rise as people who have lived experience, and our experience is valuable. It's not just worth a gift card. It's valuable experience that that we bring to the table. So keep doing the work, keep showing up, keep having conversations, and you know, if you're struggling with that imposter syndrome, reach out to me, reach out to one of us, reach out to somebody out there doing the work, because we are the ones that make the difference. We are the change that we want to see, and don't give up on yourself. Keep pushing.
Oh, that's great, Tara. Tara, thank you so much. I think I I'm glad you mentioned that, reach out to someone who's doing this work. All of the folks on this panel today would be more than happy to provide any sort of, technical assistance or, share their experience and success in what they've been doing. And we do have a lot of successes represented here on this panel today. So thank you again, Tara, and you'll be sticking around later for the Q&A. Yvette, do you have some words of encouragement, some advice for our audience?
I guess they say nothing without us. How we used to say, I guess Robin used to say that in the summit. It's very important that we stick together, right, and do the work and keep shining and keep showing up. Even if we have to keep coming and doing the work for the people who don't think they don't have the voices and they don't know no better. And they think that, excuse me, they're being stigmatized, right? We fight for them.
Great, thank you, Yvette. And I agree, nothing about us without us. And, we hear that over and over again, but it's a powerful sentiment because we don't want decisions about what we're doing and what we're getting to be made without our input, and showing up is the first part of that. So thank you very much, Yvette.
Mm-hmm.
Chris, any words of wisdom to share?
I don't know about wisdom. I have some experience. I have a lot of things not to do,
but we don't.
That works. It's a whole nother, yeah. But I guess the words of encouragement would be, you can totally do this. You don't need a ton of fun. Look, we should get paid. We're experts and we should get paid for our expertise, but you don't actually need money to do this, or at least to get started. Our budget last year was $17,000 total for the whole organization. But that, to kind of emphasize what was said before, we are the experts. So my partner and I want to build a nurse ship. And I don't know anything about building a nurse ship. So I'm going to have to find someone who's built a nurse ship before, which is great. It's just over in New Mexico. We can go there and we're going to pay a lot of money, right, for that expertise. So when you walk into a room and you're sitting down with the health department or you're sitting down with these doctors, you have an expertise that they do not have access to. So again, since we're running the syringe program, we also have access to people who are actively using and injecting drugs that nobody else has access to. So we have all of these things that are necessary for hepatitis C elimination to move forward. The last thing I'll say is that you're an expert when you say you are. So I was being referred to as an expert in harm reduction long before I actually knew a whole lot about harm reduction. And so times in the meeting when I don't understand the acronym that's being thrown out, or I don't understand the terminology. Again, I just sit there and shake my head, and then I'll leave and become the expert, right? And there's a wealth of information out there. There are the networks that we're all involved in, where you can just reach out, whether that's through any of the email threads or directly to people. Find out what it is, and then the next time you go in there, you have all that much more knowledge, and that builds up and accumulates over years. And then you turn around and you're like, oh shit, I am an expert now. This is amazing. So yeah, that's what I would say.
Oh, that's great. Thank you, Chris. Yeah, that's is that the flip side of imposter syndrome? Fake it till you make it.
That's it.
Just smile and nod, and if you're not going to ask, then you can find out and come back a little bit more informed next time.
Exactly.
That's awesome. All right, Robin, can you close us out with some words of encouragement or advice before we head over to the Q&A?
Nothing about us without us. That's the bottom line. We are the subject matter experts. Join us. An invitation to people that are following this. Join us. The more of us that we can bring together, the stronger we are. Our voices are important. Your voice is important, and I really truly believe in most cases your voice is the most important one in the room when you're bringing lived experience and your subject matter expertise.
Oh, that's a beautiful way to wrap it up. Your voice is the most important in the room when you're bringing your lived experience. Thank you, Robin, Chris, Yvette, Tara. That was a really rich discussion, and I think we're set up for a really great Q&A session here. Thank you again, everyone who's been tuning in, and in a moment here we'll get the line open for Q&A for our panelists. Nothing about us without us.